Okay, we're all set for the last presentation. And we're just going to finish off by talking about, okay, now what do we do to establish a clinic? And so there are some major advantages to having a clinic here, and that is, for example, you're helping patients. And this is a wonderful thing, and one of the nice things about our profession is we're a helping profession. It also enables you to provide a more complete service for your hearing impaired patients. Most of these patients with tinnitus have hearing loss. It's also going to increase referrals to your clinic. So if you're known as the tinnitus provider in your area, then there will be a lot of people that don't want to see tinnitus patients in the healthcare system in general to you as the tinnitus care provider. And as we noted earlier on, that many of these patients with tinnitus will require and will benefit from hearing aids. However, there are a few disadvantages. First of all, you need to know what to do. You need to have a plan in place for how to help these patients. Some of the patients require a bit of time. They're quite anxious and depressed and require your help. And so some time has to be set aside for that. I'll also mention that a lot of the services that need to be provided are not covered by insurance. So some plan has to be in place to be reimbursed appropriately for your time. And again, some patients are really upset about things, and you're going to be interacting with some people that are upset about life. And that could create some additional stress on you yourself. So to get background information, this is just one example, the fact that you're here. There are lots of really good books. Shelley shared some of those. Some of them were up on the date on the desk here today. Also, one of my favorite books, I think Shelley mentioned, is by Jane Henry and Peter Wilson from Australia, two psychologists, on the psychological management of tinnitus. And they have a book for patients and a book for clinicians. And as I said, these are my favorite books on tinnitus. There are several journal articles. We've written one actually on establishing a clinic in your practice because people need some guidance about what direction to go. So when a patient comes in, what are you going to do? Well, they need to usually typically start off with, do they need hearing aids? That's the first concern, because if you can provide them with hearing aids, that's going to be an important step. What level of help do they need in terms of the counseling? And that's determined by, in part, what problems they're experiencing. As I said, it's important to know what their expectations are. So I really want to know, why are you here? What do you expect me to do for you? And some of that is determined by, in part, what they've already tried. So if they've already been to 15 different places, or if you're their first stop, that's going to help guide you in terms of what you're going to be able to provide for them. And fortunately now there's many people interested in hyperacusis and realizing hyperacusis often goes along with this, and we've heard some strategies about both in fitting hearing aids, using sound therapy, and maybe even a little bit with counseling about how you can help these hyperacusis patients. So in the group session, I basically show this slide and I tell people twice that at this time there is no pill or dietary supplement or surgery that has been shown to help patients with tinnitus. And then I walk on the other side of the room and I choose some different words, but I say the same thing over again because patients need to hear this, and that's okay. This is part of real life, and it isn't like there's nothing that can be done. It's our job to help you, and we're going to move on and hear what the options are. So we characterized these patients in a publication many years ago. Patients come into the clinic and sometimes they're just curious and they just want to know what's going on and what's new, and is this an issue or not. There are other patients that come in and they're concerned and they want to know what treatments are available. Is this a real problem? They might require some more detail, some physiological explanation. They might benefit from self-management. They might require a guide. They might require referral to the American Tinnitus Association. And there are other patients that have come in and they're distressed. and they really want a treatment, and if you're going to help these patients, you can provide some options for what you can do to help them, and sometimes even a referral if you're not going to be prepared to help them, sometimes referral to somebody else, a psychiatrist, a psychologist that you could form connections with, or you could take charge and help in sessions. We often suggest to patients to start off in a group session that we can then be sure where they're at before we start treating them individually. Cost effective for us because we can see 10, 12 patients all at once. It's often useful to tell them to invite them to include a friend or a parent or a child to come along and be supportive and understand what's going on. And of course they see other patients that have tinnitus, and that's a really good thing because they know they're not alone. They see how stressed other people are. They see how other people have solved some problems. And there's an excellent chapter on group sessions by Newman and Sandridge that'll be in the reference sections. So if there are highly distressed patients, you have to recognize and be aware that some patients actually do commit suicide because of their tinnitus. And you have to be prepared to talk about that and to ask people, have you really thought about this? Have you had a plan? And again, if necessary, make a referral to psychiatry or crisis service. So that's something that I wasn't really trained on in school, but you have to be aware of that. We have lots of handouts for patients in the clinic, including American Tinnitus Association. We sometimes provide some of the self-help books that you saw when patients buy a device. Instructional materials, you've heard presentations and talked about websites for things like sleep hygiene. There might be local support groups for meditation, for mindfulness. You can have all these things available for patients in your clinic so you know what direction to guide them, and good for you and good for them to make them connections. So sometimes we get referrals from psychiatry to our clinic because they're not always sure what to do, and if they know we're here, that helps them. And so the handouts and the diaries are critical as well. A variety of devices available, so we might have 5 or 6 different sound therapy devices. We might have some tabletop devices available, including sound pillows and sound machines, and demonstrate in the clinic what might be available. We did a survey a few years ago about asking what patients want when they come to you. What do they want for their tinnitus? And this is the number of patients in different groups. So 100 said, I absolutely want that, and 0, they would say, no, I'm really not interested in that. What most patients want is a pill, okay? But there are patients quite willing to take an external device, a sound therapy device, and there are patients who want a cochlear implant or even an implant in their brain because they don't want to get rid of their tinnitus. So in summary, prepare yourself, and we're glad you're here, and we're glad you're interested, and it's a wonderful thing now that 25 years ago there were probably 12 people at this meeting, and now everybody's interested. Many people are interested. This is a great thing. So just develop your own counseling and sound therapy strategies. You need to consider the individual. They're all different. And then have a plan for how you're going to help these patients, both with groups and with individuals, and you should be all set. So thank you very much.